you've got this pain in your lower back, and you've got this pain on your, running down your leg, and it's really getting on your nerves. Why? Because it's literally on your nerve. The sciatic nerve is connected to your spine, and that's why they call it sciatica. It's one of the thickest nerves in your body, and it runs from your lower spine all the way down your leg to your feet. When there's any disruption on your spine, you can shift these nerves and put pressure on these nerves, and it creates an excruciating pain. This is happening because there's a slip disc or a bulging disc. It just knows that there's something shifted, and it's responding to that. That's it. It's not just that, you know, your posture was incorrect. It's not just that you have a crappy diet. It's usually a combination of things. So, you know, you've got your short-term fixes and you've got your long-term fixes. All of the short-term stuff you want to do long-term anyway. So you've got diagnosed, you know, you've got your scan, they've told you you've got a bulging disc, they're throwing you some antidepressants or some anti-pain medications, you know, anti-inflammatories, whatever they're giving you. And that might take away the pain for a small while, and a bit of stretching and a bit of physio might even help for a small while. But it's not going to fix your chronic inflammation. It's not going to change the fact that you have a big, sore, bulging disc or slip disc or whatever it is, bone on bone, and there's an issue there that needs to be addressed. Because if you don't address the core fundamental issue, then everything else you're going to be doing is just running around, you know, like avoiding the issue. So if you have dehydration in any of your spinal discs, and the cartilage gets dehydrated, it's no longer swollen. So if this is your head, and that's your spine, there's a natural curve in the spine. There's lots of discs here with lots of cartilage in there and all this connective tissue. And when that's fully hydrated, it can absorb a lot of shock. It's like suspension, hydraulic suspension almost, you know? It can take a lot of shock. And when it can't take the shock, there's a natural curve in the spine which compensates slightly, you know? So it's designed to compensate. But if we don't have that natural curve in our spine because of either muscle imbalances or poor posture or whatever, the spine's kind of more straight. And remember, the head's the heaviest part of the body. So now instead of having that, you know, that slight slack that you have, you're going to have a situation where there's a lot more tension. There's a lot more tension here, and your head's putting all that pressure on your spine. And now if you have you have too much chest muscle because you've been training chest and arms like most people do and neglecting the back. Now you're going to have a forward tilted posture slightly as well, and that's going to put even more pressure on the back, lower back here, where there's barely any muscle to support that. So we have to fix the posture, and one way we can do that short term, we can get a foam roller, which mine's downstairs, so I'll just use this as an example. This is some tissue roll, and you're going to put this around there, you know, and reintroduce the curve to your spine. And this actually feels pretty good. I might just leave this here. So, you know, and you'll feel it straight away. Like when you'll notice that, you know, that's your natural position, and that's the position you're supposed to be in. Fortunately, I have, which I also recommend, you get yourself a good office chair. If you're working at a desk or a home office or at work, wherever you are, you're spending a lot of time in front of the screen, which, by the way, my screen's at eye level. I was telling my cousin this yesterday, that when I'm sitting at my screen, I'm sitting like this. So I'm at eye level. I'm not like this. I'm not looking down at a screen like that. I'm like this. And I'm not leaning forward to get to my mouse and stuff and my keyboard. Everything's aligned. And I had really bad forward posture, and I had back pains years ago, and so that's how I know about this. So you want to fix your posture, guys. Get a foam roller if you can, just at the beginning, you know, 5 minutes in the morning, 5 in the afternoon, 5 at night. Just lie down and for about 5 minutes and just stretch it out. From stretching that, you'll know which muscles actually up here in your upper back need to be stimulated and strengthened to hold your back. So when you train these upper back muscles, you're pulling actually all of these joints and ligaments and the connection, basically your shoulders. You're pulling your whole shoulders back where they're supposed to be, and you're stretching your pectoral muscles. Okay, so all of this area here, which from being like this all day, these get tight. It doesn't matter if you're training them. The more you train them, the tighter they become. Even if you're gonna do it right. Do the whole body, do your back as well. Get your posture right, because at the end of the day, that's what's gonna make you strong. You know, a little further down the line when it really matters. Stretch your quads. That's gonna help a little bit with the pain. It's not gonna fix your back, but it will help with the pain. Massage the opposite side. So the massage, if your pain is on the back side of your right leg, you want to try and massage the, you know, equal points. So where that pain is on your right leg, find that spot, and, you know, from your glutes all the way down, start massaging, and you'll find that you may get some relief from that. Okay, I think we should start looking at our nutrition, because our spine, we have all this cartilage and all this connective tissue and a mix of proteoglycans, and I think that's what they call them. So, you know, you got protein and sugar, basically carbs mixed together, and there's something, you know, some sort of substance there, and then you've got the collagen. So that's what your spine is made of, pretty much, is a mix of those two things. And so in the Western diet, which is highly inflammatory, it basically dehydrates you. Okay, so the hydration of this collagen and these because, you know, carbs have to go with water. Anywhere where there's carbs in your body, there's water attached to it, binding to it, that keeps it. So think about your muscles. When your muscles are swelling, you know, you have to hydrate. You have to drink lots of water, and the glycogen replenishment in those muscles is stored with water. Okay, so if you stop drinking water, you're going to dehydrate. You're just going to deflate. So, or if you stop taking creatine, which also holds your water in place and allows you to drink more water. So that's something I just thought of. Maybe it's worthwhile taking some creatine. Maybe increase slightly your dose of creatine and make sure you're drinking enough water. If you are eating tons of protein, you need water. You need tons of water to just even digest that. Even to pass it through your bowels, you need a lot of water. So if you're experiencing any form of constipation, even slight constipation, and you're not having smooth bowel movements, you're in big trouble, and you need to get on top of that. You need to either reduce your protein consumption, increase your water consumption, and you know, your minerals and stuff like that. Avoiding inflammatory foods, so that means basically no rice, no potatoes, none of that crazy stuff, no bread, because that's just going to mess your life up in the long term. You're going to end up with a lot more issues than a slipped disc and a bulging disc. So I would recommend for most people, you know, stay hydrated, do intermittent fasting. That fasting is going to help you tremendously deal with the inflammation. It's going to help you possibly regenerate some of the tissues in your spine. Omega-3 is going to help you tremendously. And when you have this omega-3 to 6 ratio corrected, you're not going to have any chronic inflammation or silent inflammation. So not only will the inflammation in your spine heal, but the rest of your body where you may be experiencing inflammation that you're not actually aware of, because it's called chronic silent inflammation, which leads to chronic disease further down the line. It's also going to correct for that. So you're not just getting benefits when you correct your diet for this and you start taking the supplements. You're not just going to help your back, you're going to help your whole life. This is a calling for you, that things are wrong and they need to be corrected. And usually before people get healthy, they usually go down. You know, usually something hits you. Last but not least, something that every human being should be doing, you know, in the developed and developing world. One of the cheapest things that you can buy that's going to help your life, your spouse's life, your child, the development of that child, and the bones and the muscles and everything, right? It's vitamin D, guys. It's not a joke. No, don't just take small amounts that you get from your local, health supplement shops, the ones that in the town, the Boots, the Barretts, and all them. You don't want to go there because you're just going to waste your money. You're going to get something with a high markup. It's not bioavailable, and it's tiny amounts. It's just a waste of money. So go on eBay, go on Amazon, buy the powders, buy the pouches, buy big amounts. Get yourself a set of digital scales. Weigh up what you're doing. Save your money. Share it with people. Share if you have excess, give it to people. Like, I've got some MSM. Take some MSM. I'm gonna give some MSM to my cousin. He's gonna take the MSM, and that will help massively reduce inflammation related to specifically joints, bones, muscular, skeletal muscle, and the skeletal system. So MSM, I almost forgot to add that in there. I probably forgot to add a couple of other things. There's other things you can do too. But collagen, get yourself some type 3 marine collagen or something and see how that goes. It's expensive. The omega-3 is quite expensive. The collagen's quite expensive. But honestly, they're the ones that are going to help you the most in this situation because, having a bulging disc is quite expensive to your health. So, that's what I would recommend. I'd say do the collagen, omega-3, avoid inflammatory foods, stay hydrated. That doesn't mean just drink lots of water. This water's got nothing in it. This water's got tons of minerals in it. Okay, so you want to drink this and this. And you need to know how to do that. You need to know what to put in this and how to balance it all out. So if you just drink water, you can actually think about it. Your body's full of minerals. You're pouring water. It's like, this is pure water. I'm drinking pure water. I'm flushing minerals out of my body. You don't want to flush minerals out of your body. You want to put minerals in your body and flush out anything extra in your body, like excess salts and stuff. Don't be afraid of salt. Salt's protective. It's going to help you. That's it for now, guys. I hope you enjoyed the video. If you have any questions whatsoever, put them down in the comments box below. If you like this kind of content, if you learned a lot from it, please like, share, and subscribe. I tried to keep this short, but there's a lot of information to pack into this one. Take care. Have a great day. Bye.